While age-related andropause is a leading contributor to low T, there are many other factors which contribute to the suppression of testosterone levels, such as obesity, sedentary lifestyle, smoking, and more. And also, because there are a variety of contributing factors to testosterone deficiency, there are a range of treatment options available, dependent upon the sources of testosterone suppression. Another condition which leads to testosterone deficiency is metabolic syndrome. Metabolic syndrome is a condition exemplified by constant mild inflammation that leads to issues such as weight gain, high blood sugar, hypertension, and poor cholesterol balance. This condition is dangerous because it increases the risk of stroke and heart attack, and it also simply degrades quality of life. Metabolic syndrome is treated with anti-inflammatory drugs, one of which is known as Anakinra. Anakinra is a recombinantly derived medical treatment of naturally occurring enzyme which blocks human interleukin-1 activity. It is commonly used as a rheumatoid arthritis treatment, but is utilized in the treatment of other inflammatory issues. At ENDO 2018, Dr. Fahim Ebrahimi presented the results of a recent study which analyzed how therapeutic Anakinra affected the testosterone levels of patients struggling with metabolic syndrome. Low T is one of the most common side effects of metabolic syndrome because chronic inflammation drains the body of essential testosterone precursors, which then suppress testosterone levels. Dr. Ebrahimi expresses excitement at the results of the study, explaining that this was the first time that an anti-inflammatory drug had ever been linked to restored testosterone balance. While aging is a dominant factor which predicts low T, it's important to get the entire picture of a patient's health in order to make sure that low T is not just a symptom of another underlying issue, such as metabolic syndrome. Though studies conclude that testosterone therapy has a stronger safety profile than once believed, especially for patients under 65, there are still unanswered questions regarding the effects of bioidentical testosterone on cardiovascular health. What is absolutely clear, however, is that inflammatory conditions such as metabolic syndrome have a definite and dramatic effect on testosterone levels. It has long been hypothesized that many patients could mutually benefit from reduced inflammation and a correlated increase in testosterone production. The human body is a complex arrangement that is controlled by a wide range of hormones and enzymes. These processes are interconnected in such a way that an imbalance in one sector of the human physiology can have dramatic effects on the function of the body as a whole. When metabolic syndrome is treated with Anakinra, it appears to directly lead to not only an increase in testosterone levels, but improved blood pressure, suppressed C-reactive protein concentrations, increased strength, and restored sexual ability. By treating metabolic syndrome with Anakinra, it may be possible to simultaneously improve cardiovascular health and reduce the risk of dangerous strokes and heart disease, while also boosting testosterone levels and providing the same benefits that are offered by a testosterone replacement therapy. Unfortunately, there is still much more work to be done. This Anakinra study is a precursor to future large-scale studies, which will provide stronger evidence and allow us to come to more nuanced conclusions. What is abundantly clear after generations of study is that healthy sex hormone levels are strongly associated with positive health outcomes in both men and women. Low T has a pronounced negative impact on male health and wellness, associated with depression, reduced exercise capacity, obesity, hypertension, and more. By connecting the dots of the endocrine system, we will be able to more accurately and effectively treat hormonal disorders and amplify quality of life while minimizing the risk of side effects. For now, the most surefire way to restore testosterone levels is with bioidentical testosterone therapy. But this Anakinra study and others like it will open the door to new avenues of treatment. The overexpression of inflammatory hormones like cortisol have a negative effect on sex hormone production. In just a matter of years, low T may be largely diagnosed as a side effect of underlying chronic inflammation and metabolic disorder. In the near future, advanced anti-inflammatory treatments will likely play a similar role in the treatment of testosterone deficiency as recombinant testosterone injections, creams, and patches play today. The recent Anakinra trial featured 70 participants, all males between the ages of 18 and 75, suffering from a combination of obesity and clinical low T. These patients also had at least one symptom of metabolic syndrome, such as hypertension or prediabetes. Participants were split into double-blind placebo and experimental groups and provided injections for a month twice each day. After a month of injections, participants taking Anakinra underwent an 11% increase in testosterone combined with a 51% decline in CRP levels, meaning that patients experienced a boost in testosterone as the influence of inflammation waned. Placebo patients had no significant effects in either category. Upon further investigation, patients with CRP levels above 2 mg per liter experienced a 24% testosterone boost, while patients with CRP concentrations below 2 mg per liter maintained baseline testosterone levels. Along the same lines, testosterone levels increased most dramatically among patients with the highest BMIs. Anakinra is a strong candidate for testosterone enhancement because it has such a low incidence of significant side effects while also providing other significant benefits. 21 out of 35 experimental patients experienced mild to moderate, 11 versus 10, injection site irritation. A handful of patients taking Anakinra experienced diarrhea or nausea that may or may not have been related to treatment. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding hormone replacement therapy, please click the link below in the description.